Hello doctors, get back to my channel. Today we learn on classification and complications on fractures, and this is 5 marker basically mostly asking in clinical. Here on the basis of etiology, it means the causes. It might be any traumatic fracture, it means any fall. A fracture which is sustained due to trauma is called traumatic fracture. And the fractures will be caused by a fall, road traffic accidents, etc. And next is a pathological fracture, a fracture through a bone which has been made weaker due to some a disease. So that is a pathological fracture. Here the example, fracture of bone which is weakened by the metastasis of the bone. Next is your stress fracture. This is a special type of fracture sustained due to any chronic, it means longer periods repetitively injury and the causing to a breaking of the bone in trabecula. That is your stress fracture. Next is your on the basis of displacements. It might be undisplaced fracture and displaced fracture. Your undisplaced fracture, these fractures are very easy to identify. It means it is because of, in this you can see in this picture, displaced or non-displaced. Your displaced is a pulled out, and you can see the bone, it is in not in normal alignment, but it is in displaced. It is in a non-displaced, you can see the bone lies in the normal alignment. Displaced and non-displaced is the difference between the alignment of the bone. And in displaced fracture, there are some of the factors like it may be any fracturing force and the muscle pull on the fracture and the gravity acting on it. So the displacement can be in the form of shift, angulation or rotation. And on the basis of environment, it might be closed or opened. As you can see in this picture, you can clearly understand. A fracture not communicating with the external environment, it is closed. And the open fracture, a fracture with break in the overlying skin and soft tissues and communicating with the environment. And it is more prone to infections as it is out of the environment. And it is internally or externally open fracture. Next, on the basis of complexity of treatment, simple fracture, compound fracture. Your simple fracture, fracture in two pieces and it is easy to treat. Like here, transverse fracture of humerus. And compound fracture, fracture in multiple pieces, difficulty to treat, like in tibia. On the basis of pattern, transverse fracture, oblique fracture, spiral fracture, communicated fracture, segmental fracture. In this pattern, transverse fracture, it is the fracture line perpendicular to the long axis of the bone, and it is caused by a tapping or any bending the force. And the oblique fracture, fracture will be in oblique and caused by the bending force. It means the bone is along the long axis. And the spiral fracture, fracture lines runs spirally in more than one plane and it is caused by the twisting force. Next, communicated fracture. Communicated means there are some of the many fragments. Fracture with multiple fragments caused by a crushing or compression force along the long axis of the bone. And next is your segmental fracture. There are two fractures in one bone but at different levels. You can see all these fractures in this type. Transverse fracture, your oblique fracture. Your transverse is perpendicular, your oblique is oblique to the long bone. And you can see the butterfly fragment, or only the one end of the in the middle, and spirally communicated many fragments and segmentally two pieces. Let us discuss about the complications of fractures. Immediately, early, late. These three are most important. Immediate complications in systemic, hypovolemic, and locally it is injury to major vessels, muscles, tendons, joints and viscera. Your early complications systemically hypovolemic shock, acute respiratory distress syndrome, fat embolism syndrome, DVT and pulmonary embolism and any septicemia. Your locally it infections and compartment syndrome and late complications like delayed non-union, malunion and cross-union. So these are the classifications and complications of your fractures. Thanks for watching my video. Like, subscribe and share.